will be Richard Doherty, who is the Dean at the College of Physicians, who will talk about demonstrating professional performance.
Thank you, Jennifer. Now, this is not an RACP presentation, this is a presentation from the three colleges because in March of last year we convened a workshop meeting of the sort that you've been hearing about that happened yesterday when we talked about CPD, and we had a facilitated discussion about the ways in which the colleges could participate in the process of demonstrating professional performance. And I'm assuming the green button is the move forward. So we had convened a steering group out of the executive committee and members of the colleges involved, and we were able to use the resources of staff in the College of Physicians to undertake some work looking at a survey of what was happening around the world with regard to revalidation, and undertook a formal and extensive review of the literature, which included the medical newspaper type press as well as the peer-reviewed literature. We were able to then circulate a substantial pile of material to people as pre-reading material, and then had a facilitated discussion at the 2013 tripartite college meeting. And what I'd like to talk about is basically a very brief sort of almost narrative summary of the outcomes from that meeting, which have been written up into a long version and a short version. Most of what I'm going to talk about now is simply a reiteration of what you've already heard, and in many ways I hope it's got some residual interest, because the more I listened this morning, the more I realised that we've really got gathered here today the people who actually contributed the literature that informed our discussions the other day, or last year. So we've already discussed the issue of community attention on competence and professional performance of practitioners, and Sir Peter Rubin and Andrew Connolly and various other people have talked about the importance of those perceptions. We've had Ron Patterson's work mentioned, and Ron was a participant in the process previously, and of course from his position as the Health Ombudsman from New Zealand previously, we had ample evidence of comments of the community's perspective on the performance of doctors and the expectation that doctors would maintain their professional standards and their performance. The other thing that we noted that we felt was particularly important was the appearance of co-regulation programs where the professions and the regulators could work together to share perspectives and to work together to develop productive arrangements by which programs like revalidation could be introduced. We've talked about the community assumptions, and again, I think, well, despite the conversation that the discussions that have gone on this morning, I think there actually is pretty good evidence that the community assumes that there are rigorous processes to ensure regular assessment of performance by medical practitioners, and that practitioners maintain contemporary skills and knowledge. And it's particularly that dynamic perspective which is important in the literature, that people understand that things have changed since we trained, so that as time goes on we've had to maintain our skills, we've had to develop new skills, we've had to implement new thinking to basically stay in the same place professionally. So practitioners are expected to demonstrate ongoing professional performance individually, but again, as has been pointed out repeatedly this morning, and I think particularly by Jocelyn Lockyer, the performance is contextual, and what somebody does is very heavily influenced by the setting of their practice and the role of multidisciplinary teams in contemporary practice, new models of care, the introduction of new technologies, the diversity, the changing diversity of clinical settings and so on. And again, you know, we flagged that, we've heard more detail, and a much more rich picture of that is emerging subsequently. We spent a fair bit of time thinking about the learning and assessment strategies that would be relevant to situations in which doctors were trying to demonstrate their, or assure the community that their performance was up to scratch. And so we concluded that assessment frameworks and tools needed to be developed, needed to be implemented, needed to be modified, so that there was an evidence base to show that the things that were being used were effective, recognising that that's not always immediately possible with practical programs. Things needed to be relevant to competence and performance, and this has taken a considerable step forward in the last year with the development of concepts about competency-based CPD, competency-based education. And we felt that it was very important that whatever was done could be seen to be adding value to clinical activities. So that the learning activities that people would undertake would be practical, integrated into practice in the work setting, and this goes for assessment programs as well. That learning programs should accommodate different styles. This is really a contemporary pedagogical theory for adult learning. There's nothing particularly earth-shattering about that, and that learning programs should be focused on the enhancement and further development of competence and the improvement of performance, with a view ultimately to affecting health outcomes. And so again, it was recognised that like any assessment situation, the overall utility of the assessment process needed to be kept in mind, and so the CARVE criteria, cost effectiveness, acceptability, reliability, validity, efficacy, and so on, were considered to be important factors. So just to revisit the issue of assessment briefly, obviously it's important that in this area where we're starting to think about how to develop assessment strategies that can be integrated into the workplace, that can contribute to effective learning, that can be acceptable to practitioners, can be minimally intrusive and so on, they still need to meet established standards. So we need to ensure that there is enough reliability, enough validity in assessment processes to ensure that we're actually getting meaningful information, particularly if there are going to be important decisions made on that. We've heard a lot about multi-source feedback, and there was a recognition in our discussions last year that that aiming your multi-source feedback process at quality improvement as an outcome was very important. We felt it was important that audit processes were embedded, and we've heard about developments that have come along from there since then. We've also talked about peer reviews and the importance of multi-source feedback as multi-source reviews as a way of providing feedback, and we're going to hear more about that later on. Again, we identified the issue of individual performance and team performance, and the need to look at both, recognising the importance of context. We felt very strongly about the need to ensure that these whole processes, the assessment itself, the whole revalidation process, if we were moving towards that, could be embedded into workflows where possible. And just, I guess, bookending the comment that we need assessment strategies that meet established standards, we need to ensure that any metrics that are being gathered are used to increase validity and reflect relevant practice context, so that one of the challenges with assessment, of course, is that it's very tempting to do the things that are easy to assess rather than the things that are important to assess, and we recognise the importance of that. So we tried to define then what the role for colleges might be, and I've tried to set this out here as a framework for governance for colleges. So the colleges reflected in the work of the three colleges as sponsors of this meeting so far, are keen to partner regulators in developing processes that focus on continuous improvement of performance. We've accepted that. Setting the standards, actually being able to say, this is the level of performance which is appropriate for this particular craft group or this particular practitioner. Creating transparent reporting frameworks, so helping develop systems that allow people to input information and it's used effectively without fear that they're being either diverted for some other purpose or that they're being misinterpreted. Obviously, defining assessment processes and tools is a thing about which we feel strongly that we have the role. And then providing the comprehensive CPD programs, and we recognise, as per the discussions that we've heard this morning and previously, that the potential for evolution of CPD programs so that they contain elements which will permit this process is going to be important. And then recognising the importance of looking at CPD for appropriate for particular career stages and continuous improvement. So again, we seek that shared role with the regulator in developing a governance framework, and we spent a long time thinking about the definition of a profession. So the tripartite collaboration has over the last few years actually published a statement on professionalism, which includes an effective definition of a profession, but it fundamentally comes back to the idea that we accept the responsibility for self-regulation. We've heard important advice from Sir Peter Rubin about the need for colleges to step into that arena to actually say, yes, we are prepared to be part of this process. And that's fundamentally important to us. We do need to accept responsibility for management of poorly performing practitioners, but particularly from the perspective of developing remediation processes for people who've been identified as poor performers. So this is a fundamental role for colleges to assist people who've been identified as needing either specific areas of remediation or general areas of remediation to actually help them achieve those goals. And we've talked briefly already about reporting frameworks. So we would like then to propose that the colleges have a role as allies for regulators through change management, particularly as thoughtful intermediaries between the fellows or the practitioners and the regulators. And that colleges obviously have a very important role in communication and change management strategies. So the defined outcomes from our 2013 discussions were that we agreed to continue to collaborate, and I guess today is a good example of that we wanted to keep working on sharing ideas on common issues, particularly with regard to performance-based learning and assessment tools for performance rather than simply content knowledge or low-level competency. And we identified a series of future collaborative activities which have been partly realised but are still considered to be well and truly on the table. This is probably too many words, but it simply identifies a framework for demonstrating professional performance and really identifies the points that we made before about lifelong learning, continuous improvement, defining detail standards, understanding the context, making things practical, relevant, collaborative, outward-facing, simply referring to the fact that we want to make it obvious to the community that we're doing it, showing leadership in the profession, and that it's transparent, accountable and measurable. And we did finish with a very complicated thought bubble type diagram, which probably takes longer to explain than we've got. But what I really wanted to emphasise was the vertical rectangle towards the right-hand side with revalidation, and the issue that the colleges were struggling with, and I guess that we still have to see how we can resolve in collaboration with the regulators, is where does the college's educational and support role finish, and where does the regulator's enforcement function begin? And it's that interface that still needs to be worked on. We still need to understand. But in the end, it's our profession, but these are our communities. These are the people we work for, and our patients are what we do this for, and it's ensuring that their outcomes are the best of all. And I commend this wonderful sculpture from the Ottawa National Gallery again to you all as an embodiment of that. So thank you.